Working on an oncology floor, I see newly diagnosed cancer patients all the time, and they all seem to have one thing in common. They're terrified. Ward, as a patient diagnosed with terminal cancer for the past 3 years, what is the most important thing you could tell someone newly diagnosed or to someone who's caring for someone with this terrifying disease?
That's a tall order, Steve. I mean, this is a life-altering, life-shattering experience, not only for the patient, but for the caregivers and the whole family. You know, to try to narrow that down to one specific thing. But as I think about it, in my own case, there really is something that had a profound effect on the entire journey. Now, I've been on chemo for 3.5 years, and not everybody has that experience. Very often, it's a few months, 6 months, something like that. And so, let me just say at the outset, I can only talk from my experience and the people I've run into. Everyone's experience is different. But here's the thing. I showed up, I came to the doctor's office, I came to the diagnosis with a lot of preconceived ideas about what cancer meant, what chemotherapy was, and those were horrific. I mean, it was a death sentence, and it was a sentence of torture. It never entered my mind that I wasn't about to experience the worst that life has to offer. My experience was limited. Television, radio, you know, TV programs, movies, things like that. But what the message that I gleaned from all that was horrific. And chemotherapy may be as bad or worse than cancer. And I think of dramas where that's the decision. Do I get treatment or not? And of course, some people choose not to. In my case, I was told I had 3 months to live unless we got involved right away with chemotherapy, and that with aggressive treatment, I might have 3 years. So at 3.5 years, I'm happy. This is gravy. But those preconceived notions that I had sent me to bed for the first year. I literally felt that everything was going to be horrible. There was going to be pain. There was going to be nausea. There was going to be all of these things. And that's what I experienced. Now, what's amazing is that my doctor checked in with me every week or two. How you doing, Ward? And I would say in my mind, well, considering I'm living in hell, I'm doing all right. Now, think about that. What my doctor heard was, I'm doing all right. He didn't hear my caveat of thinking, well, all things considered, that I'm living in hell. And so we talked at cross purposes. Now, I'm having some kind of side effects from cancer. I'm having some kind of side effects from the chemo. I'm having some kind of side effects from the pain management, the opiates, which is very powerful. And I've got this all-powerful, overarching belief that life is over and that I should be in bed. Steve, no one ever told me that it was manageable, that you could live with chemo. And so my focus with these presentations and with the book I wrote is how to live with cancer. Because no one ever told me about living. It was all about the disease, fighting the disease. It was staving off death. And, well, we're all going to die. But while we're alive, that's the challenge. Again, everyone's experience is different. And some people need to go to bed. And that doesn't mean that they have to suffer. Pain seems pretty inevitable in all of life. But my experience has been that suffering is optional. Suffering is something that goes soul deep. And I brought that to the experience. I brought that with myself, from my own psyche. And it took a lot of time and a lot of work to get beyond that. So now, 3.5 years later, my body's getting worn down by the chemo. I'll acknowledge that. But my spirits are up. And so I found I can live with chemo. It can get pretty tough sometimes. But they have medications to help. You can deal with it. I've dealt with it. And so regardless of your own individual experience, what I want to encourage you to do is to create a starting point for yourself. Do some research. Find out what the worst is going to be. Look, make a list of the possible symptoms of the disease. Make a list of the possible symptoms of the therapy, chemotherapy, surgery, or whatever it is that you're going to have, radiation. Look at those things and have a positive attitude. Do some research, ask some questions, maybe go to a support group, talk to other patients. It's hard to generalize, and that's why it's hard to get straight answers sometimes. But the bottom line is, the message I never heard is that most people manage pretty well. That should be the standard that we strive for, not the one that I brought to the table, all suffering, all doom, all darkness. It's amazing I survived it all. It really is. And to have a bright outlook like I do now is phenomenal. It's a gift. It's a real gift. And there are gifts from this cancer experience.